And joining us here on News 10 today is we have Greg Riley. And today you're going to educate us on diabetes with kittens, I believe.
Kittens and dogs, and basically what I've done is brought a little diagram for us, which I know sounds pretty funny and silly for this time of the morning, but
it's perfect.
It is perfect, hopefully, but basically a quick overview on diabetes is that the pancreas, which excretes insulin over a period of time, with a patient that does not have that capacity, what we have to do is supplement it with insulin injections. So what we do is that, say, 7 a.m. and 7 p.m. is when you're going to be wanting to give the injections, okay? So what will happen is that the blood sugar will be going up to a certain level, and we'll just say, say 400, okay? Which is above normal. What will happen is you'll give the insulin injection, and that blood sugar, when it's being monitored over a 2-hour period throughout the course of the day, it'll go down. Right around about 1 o'clock or so in the afternoon, it'll start going back up when you're going to want to give the injection again.
So you're kind of giving people a timeline. If you have an animal that has diabetes, this will kind of give you an idea of when to not give them a shot, when to give them a shot, kind of the pattern of it.
Right, exactly. And basically, this little wave action is kind of like, say, a yo-yo, more or less, of what your blood sugar is doing. Now with dogs, over a period of time, if you get some weight control over them, you can kind of monkey around with the insulin injection and the dosage. But with cats, what's really interesting is that if you actually get enough weight off of them, sometimes they'll go into remission and you won't have to give the injection to them.
So you almost weed them off of diabetes completely?
Pretty much, close to it. But the biggest thing is that carbs is going to be the big trick with cats mostly. If you get strictly mostly a good protein diet, they should more or less go into remission.
Guys, is diabetes usually very common with cats and dogs? I mean, do you see this a lot as a veterinarian in your clinical area?
It really depends. Obviously, Kevin and I, we were talking earlier in the hallway. If you have a dog that's going to be really obese, chances are they may come down with diabetes. Cats, if their cats are also really obese, they're going to come down sometimes with diabetes too. But the big thing that a lot of people will notice is that if you have a cat that's outside and it's feral, they're mostly carnivores. They're not eating the fillers and so forth that are going to be in our pet foods. So that's going to be a result of they're not going to have diabetes if they're outside.
And I don't know if it matters with the type of dog that you have, but are there different breeds, I guess, that are more common to have diabetes?
It's a pretty good question, and I would have to say no. I mean, any breed can really come down with it. Obviously, there are going to be some dogs, just like in people, that are going to be predisposed due to genetics of coming down with diabetes. Some of the symptoms that are going to be is drinking a lot of water, urinating a lot. Sometimes they'll be eating just ravenously, or sometimes not eating at all. So if you see a patient or a dog or cat, obviously, that's going to be drinking a lot of water and urinating a lot, that's usually an indication of they having coming down with diabetes.
Sounds pretty good. That's pretty good information.
It is. It is. And one thing, Greg, put that chart back up. I want to show something. And camera operators, up on the upper left-hand side of the screen, I want to show. Look at that. Now, did you draw that yourself?
Yeah, that's mine. That's pretty cheesy, but yeah.
No, it's not cheesy. I think that's cute. I think that's cute. And,
well, thank you, Kevin.
And so I just wanted to point that out. Very good information, but I couldn't help but noticing your little artwork.
That's
there.
his stamp of a puppy dog.
Stamp of a puppy dog, yeah.
All right, sounds good. Great information, Greg. Thank you for joining us here today.